So what we employ people to do is to check to see if you see any discolorations and report as you see them.
Let's talk about oral hygiene, because you've brought it up. What exactly is that? When you say somebody's practicing good oral hygiene, what does that picture look like?
So oral hygiene is basically the oral health of someone, of a client. So if we say someone is practicing good oral hygiene, they are following the something we call the oral hygiene instructions: brushing twice daily, flossing, using the tongue scraper or cleaning their tongue, seeing the dentist as regularly as they can. Usually it's like twice a year, going for regular checkups, doing their routine cleanings, reporting any minute or small issues they come about or see in their mouth. That's basically what we call good oral hygiene.
What happens to your mouth if you don't brush twice a day?
I mean, it's like, let me give you an analogy, right? It's like you not cleaning your room very often. There's always things that we put in our mouths, right? You have to clean your mouth regularly to take out these things, to keep your mouth very clean. These things, the dirt or something we call dental plaque, they accumulate and cause a lot of issues. One being the cavities or dental caries I talked about. So it's very important to keep your mouth clean or brush twice daily. Okay. Brushing once usually doesn't do the trick. Yeah.
And then you talked about flossing. What is flossing?
So flossing is basically using a floss. A floss is a filament.
Mm-hmm. Like a rope?
Yes, made of nylon.
Okay.
Yeah. So usually when you brush the surfaces of your teeth. But there's another surface, interproximal surface, that needs to be cleaned. You know, when you chew some things, you feel like sometimes there's some
small meat to be
exactly.
Inside there. Yeah.
You can't get it with a brush, so you need a floss filament to get in between those teeth to clean. So it's very important, because some of these cavities, they can occur in between these in these spaces.
And then you mentioned tongue scraping. It sounds quite painful. What was that?
Oh, it's not necessarily scraping your tongue, but it's an act of cleaning your tongue. And then the device that we advise people to use is a tongue scraper. You can use your brush. I mean, it's fine, but I think using a tongue scraper is more convenient.
Okay.
Yeah.
And what is that supposed to do for you?
Sometimes when we are brushing, we forget to clean our tongues. Mm-hmm. So I think using a tongue scraper or using your brush to clean your tongue, you just remember to clean your tongue, because some of the food particles get attached to the tongue, and that can reduce the quality of your oral hygiene.
I'm curious though, are there any health conditions that can lead to toothache?
Yes. Toothache is a whole issue on its own. There are lots of things that can cause toothache. There are some non-dental causes of toothache. Usually when we have something we call TMJ pain. TMJ is the jaw joint, basically.
Where?
Here.
Here.
Yeah. So when you have TMJ pain, the pain can radiate to the mouth, to the teeth.
So it can spread from there all the way to your teeth?
Yeah, exactly. So you might feel some pain in that area and also in your teeth, and you might assume that you have toothache, but it might not be the cause. There's also been some cases where something we call cluster headaches can cause toothaches.
Cluster headaches?
Yes. Some people also complain of toothache when they have sinus infections. Mm-hmm. Yeah.
What's a cluster headache? That sounds quite painful. Is it like lots of headaches going on at once?
It's basically just a headache that occurs on one side of the head.
Okay.
It can be quite painful.
Right. Normally on which side of the head?
It can be either side.
Any side of the head.
Yeah.
And then it radiates to your teeth.
Usually they feel pain in their tooth also. Okay. Something that has been noticed, yeah.
Okay. So it sounds like different things can cause toothache.
Yeah, lots of things.
So when you start feeling, can stress cause toothache?
Not necessarily. Stress can aggravate some of the issues that can lead to toothache. Mm-hmm. Yeah. Stress, if someone has a medical condition, stress can aggravate it. Mm-hmm. Stress can lead to dry mouth. Dry mouth can lead to some oral health conditions that can lead to headache. Toothache. Yeah. So it might be a factor. It might be one.
I'm curious about dry mouth though. Why should dry mouth lead to pain in your teeth?
You know, the saliva is something that's very important in the mouth. It cleans the mouth also. It's one of the functions of the saliva. Yeah. So when someone has dry mouth, for any reason at all, the cleaning ability of the saliva is reduced. Mm-hmm. And then there's more accumulation of food particles on the tooth, and then that can lead to some of the cavities that we talk about. That can lead to something that we call periodontal diseases, and all of those can lead to toothache. Okay. Yeah.
You're watching GTV Breakfast. We're looking at toothache, and if you're teeth are hurting you, maybe this is a good time for you to get this, some consultation with Dr. Enoch Adjei, who is a dentist right here on the show, and then go and see your favorite dentist. The number to call is, or the WhatsApp number is 055-556-1034. 055-556-1034. The WhatsApp lines are active, so give us a WhatsApp and send us all your toothache problems. Okay, so how about diet? Is there a link between diet and toothaches?
When we talk about diet, we usually advise our clients to avoid sugary foods, foods with a lot of refined sugars, because sugar is one of the things that can cause the issues in the mouth that can lead to toothache. Right? So we advise people to stay away from refined sugars, diets that have a very high content of refined sugars, sticky foods, because they stick to the tooth, to the oral structures.
Like honey or what? Honey is not a culprit.
Yeah.
Sticky foods.
So like there are these sticky toffees.
Okay, sweets.
Yeah,
toffees.
Exactly. That can stick, and then it can be difficult to clean depending on where they stick. We advise people to stay away. So basically, we advise people to have a balanced diet, a lot of vegetables, a lot of raw veggies. It can help clean the tooth also.
Okay.
So basically that, and avoid sugar as much as possible.
How about fruits? Fruits have sugar.
Exactly, but they have a fiber content also.
That's the difference.
Yeah, I mean, eating fruits, they have a fiber content. As I said, they can help clean the mouth as you are eating them. So it's not bad to eat fruit. Yeah.
Can some toothaches just go away without seeing somebody like you?
I mean, people usually complain that, oh, they had a history of toothache a while ago and it just disappeared. That doesn't necessarily mean that the problem is gone. Looking at how toothache, the cause of dental issues, there can be a point where you can have a dental issue without pain, but that doesn't necessarily mean that the problem is gone. So someone might think that, oh, there's no pain, so I don't have any dental issue, but then there's still a problem that needs to be seen. So we usually advise people to present even if you don't feel any dental pain or toothache. Yeah.
What's the most serious case you've seen of someone who ignored a toothache? I mean, what are the craziest consequences that can happen? I
mean, there's a lot of sequelae when it comes to dental issues, dental infections. There's a whole flowchart. Someone can come in with a small dental pain or toothache. It might be from a very small cavity that can progress to a big cavity. The person might lose the tooth as a result. The person might have infections. If the infection tracks down to the supporting structures of the tooth, can have infection of the bone, the jaw. There can be infection of the surrounding soft tissues that can extend to the structures of the face also. So you usually see people coming with swellings of the face. Usually it's unilateral and can be bilateral. Yeah, it can be
so
that serious.
Either one side or both sides?
Yeah, exactly.
Okay.
And that can cause a lot of pain, reduce your quality of life, and usually cause some severe health issues. Yeah.
Do you see a lot more younger people presenting with toothache problems? What's like the distribution in terms of age?
Distribution, I think it's more young, and I don't think there's actually a distribution. I think young people are paying more attention to their oral hygiene, their oral health these days. But we still see a couple of young people present with toothache. So it's still something we need to talk about. Yeah.
What are the consequences of ignoring toothache?
A lot. So toothache, pain is it's not comfortable. Toothache can range from mild, moderate to severe, and when it's severe, it's very bad. Basically, it reduces your quality of life. You're usually not able to chew, you're not able to talk, you're not able to enjoy the things that you usually do with your mouth. You understand? So having toothache, severe toothache, can be very, very serious. Yeah.
Is there a link between toothache and bad breath, halitosis?
Sometimes the causes of toothache or the things that cause toothache usually sometimes can cause halitosis. For example, if there's a cavity, there might be food packing in that cavity that can lead to halitosis or bad breath. If there's periodontal infection or periodontal disease, that can cause halitosis. So there's a correlation with dental pain or toothache and some bad oral odor. Yeah.
What are some tips you can give for people to, in terms of this education around toothache? What are the key things they should know, really?
So basically, just try and maintain your oral hygiene. Brush twice daily, that's the first thing we talk about. Try and floss, try and clean your tongue. Visit your dentist at least twice a year. I mean, it's fine if you think that you don't have any dental issues, but just go and see your dentist and confirm. If you have any dental issues, no matter how small they are, try and visit the dentist for treatment, because these issues, they escalate pretty quickly, and then the bigger they get, the more severe the pain can be, and then the treatment also.
Can you put too much toothpaste on a toothbrush? What's the ideal?
Yes, actually.
What's the ideal amount of toothpaste?
So basically, for adults, we say a pea-sized amount.
Something small like that?
Yes, pea-sized.
Pea-sized?
Yes, on your toothbrush. But some people just like to spread the whole...
I think it's the adverts. When you see the adverts, the whole thing is on the whole brush.
Exactly, it looks nice. Yeah. But we advise people to use a pea-size.
A pea-size?
Yeah.
Okay.
It's enough for...
to do the work.
Exactly.
And how long should brushing take?
Ideally 2 minutes.
2 minutes.
It's not that long.
And then a lot of us are guilty of we are gone, you know. So it should be like a 2 minute.
Yeah, you should be thorough. Yeah, there are different brushing techniques, and these brushing techniques, they tell us to be thorough, to clean very well, because you're cleaning your mouth. Okay. Yeah, it's something you're going to use.
All right.
Yeah.
I can see my cameraman looking at themselves and wonder, I don't spend 2 minutes in the bathroom brushing my teeth, you know. Yeah. and so it's like, and is it up and down, hard? I don't know. What's the ideal?
So the whole thing with toothbrushing is, first you need a medium, for an adult you need a medium bristle toothbrush. Yeah. You need a fluoridated toothpaste. Yeah. So you apply your pea-size. You go quadrant. A quadrant is a section of the tooth. So let's take the upper part divided by 2. Okay. So the right side is 1 quadrant. Right? Exactly. So you go. There's a brushing technique. You angulate your toothbrush
like that
to your gum line. You do wiggle motion. Okay. You flick down. Okay. That's a.
And then we do the same for there.
Exactly. So you go tooth by tooth.
Okay. Oh, tooth by tooth.
Yeah. So, yeah.
Man, we're guilty.
So you clean every single tooth. Exactly.
Okay. I did not know this one. Yeah. I thought we cluster the teeth, maybe some 10, then we deal with them.
Some toothbrushes, the bristles are wide enough to cover, I think, 3 teeth.
Okay.
So you can clean 3 at a time. Okay. Exactly.
All right.
But ideally, you should
give attention to each single tooth.
Yeah.
All right. And then, of course, clean your tongue as well.
Exactly.
Yeah. Floss, scrape. Yeah. Now, somebody comes into your practice and he says, I'm feeling pain. What process do you go through in the office?
So for a walk-in, usually we see the patient. We do something we call a history. Okay. So we take a history of the patient's complaints. So we ask them what the problem is, how long it has been. We ask them to explain what they think is the cause of the problem. We take some other details, their medical history, their drug history, some family history as well, social history. So we basically take the demographics and their complaints. And then we do something we call examination. We use our instruments to thoroughly examine the patient to see if there are any causes of what they perceive. Okay. Yeah, so we use intraoral mirrors, we use our lights, we use our probes, you understand? And then after that, if we perceive that there's a cause of the pain, we can also do investigations. It's been x-rays. Okay. So there are small x-rays, you can take, there are big ones. We can also do sensibility tests to check whether the tooth is vital.
When you say tooth is vital, what does that mean?
If it's alive or not.
Okay. Yeah. The teeth are alive?
They can die? They can die off, yes. Okay. Basically, yeah.
All right.
So we do a lot of things to check the problem. Okay. And after we are sure of what the issue is, we go ahead and discuss treatment options. Okay. Yeah.
A couple of quick questions here for you on WhatsApp, 055-556-1034. This is Umar from Tamale. Please do tooth replacement. Oh, just left that. Oh, come on. All right, let's go. Umar, your message is here. Tooth replacement and capping, do they have any side effects as a person grows?
You know, something that's not made by God usually does have a side effect. And they don't last, but we call them long-term replacements. Okay. So depending on how it's done, who does it, how well it was done, there can be some issues. But when it's well taken care of, when it's well done, it can last.
Okay.
Yeah.
Alcina Jr. is just sending us some love. He says, love the show a lot. Just want to thank you guys for educating us this morning. Bless up. So Alcina is enjoying the education from you. This is another message here coming in from Gilbert Dunu, who has sent us WhatsApp on 055 556 1034. Sometimes I get some bleeding in my mouth. What's the cause? How can I avoid it? Yao, Gilbert.
Yeah. So bleeding, especially when you're brushing, it's usually a sign of periodontal infection. Gingival inflammation, gingivitis, periodontitis.
Okay.
So for that, there might be some plaque accumulation.
Okay.
Dental plaque.
Is that the rough stuff you feel when you flick your tongue around your teeth? You feel some
Exactly.
which is
something
not tooth.
that's not exactly.
Okay, so that's plaque.
Yes.
Build up.
Yes.
Okay.
So there might be some build up, and then they usually cause inflammation of the tissues around it that can lead to bleeding.
Okay.
So that can be treated by improving your oral hygiene, coming in for a checkup, and maybe some professional cleaning.
Okay.
Yeah.
All right. 055 556 1034. Dr. Enoch Adjei is a dentist. He's right here. He's giving us education on toothaches, where they come from, how to deal with them, how to know when you have a problem, what to go do, how to even prevent some of this stuff that's happening in your mouth. Correct oral hygiene, brushing your teeth, flossing, scraping, and just giving your teeth and your gums and your mouth some good love. All right, I think there's another message here I want to take. What is the cause of sensitivity?
Yeah. So sensitivity, some people perceive sensitivity, especially severe sensitivity, for pain. It can be caused by a couple of things. Usually a fracture, when a tooth structure gets broken. It exposes a part of the tooth that can be sensitive to hot and cold foods, and changes in temperature and all those things. When there's tooth wear, it usually occurs when there's an issue. Usually when people go old age, they can experience tooth wear. That can lead to sensitivity as well. So, yeah.
Okay. Talk to my brothers and sisters who have a habit of popping a bottle into their mouths and then opening the bottle.
Yeah.
Talk to them.
It's not a good habit. It's likely they might fracture their tooth sooner or later. The tooth is not meant to open
bottles.
No. So you are prone to getting fractures that can lead to pain, sensitivity, a lot of issues, and eventually sometimes we would have to take out the tooth.
Take out the tooth. Okay. Now I see some people grinding their teeth almost subconsciously.
Yeah.
What's going on there, and what's the link with that and toothache? So
it's called bruxism. Like you said, it can be subconscious. Sometimes it can also be linked with people under stress. The correlation is when you grind, you wear the surface of your teeth. Like I said, there are some parts of your teeth that, if exposed, can lead to sensitivity. And then severe sensitivity can be perceived by some people as toothache. So I think that's the correlation.
Okay. Alcina inside Kafui City, where the flowers are, he says, what is this tingling sensation that he sometimes feels when he chews or he drinks cold water?
I think that might be the sensitivity. When someone has exposed, let's say, dentine, right? Differences in temperature, like I said, to hot and cold foods or drinks can cause that tingling sensation that we term as sensitivity. So I think that's what.
All right. Kwabna team wants to know, what's the basic effect of implants?
Basic effects.
Why do we even have to have an implant? What's an implant really?
So an implant is basically a replacement option for when you lose a tooth. Right? So the whole idea about implant is we are putting the structure into the bone, the bone of the of the jaw. So it's more secure. The aesthetics, how it looks better than the other options we have. Long-term prognosis can be better.
Well, that's all we have time for. Thank you so much for all those messages coming through to us on toothache and tooth-related issues. Dr. Adjei, for somebody who just got up from bed, brushed his teeth, and just caught the end of the show, what's this 1-minute summary you can give him or her about toothaches?
Toothache is very common. a lot of people perceive toothache and then they assume it to be something they can ignore. I think we should report to our dentist as soon as possible if we have even the smallest of pain. Keeping our oral hygiene optimal is very important. Brushing twice daily, and flossing, visiting our dentist twice a year, even if we don't have any dental issues, is very important. Visiting your dentist if you have any small dental issue at all is also something we advise people to do.
Okay.
Yeah.
See more teeth and open more mouths today.
Okay.
Thank you very much.
Thank you also.
Dr. Enoch Adjei is a dentist and is medical officer at the Oral Health Directorate of Kafui Teaching Hospital, not too far away from where we are, the beautiful palatial environment of the Otumfuo Osei-Tutu, the second Jubilee Hall in the heart of Kumasi. The show is brought to you by Awake Purified Drinking Water and Medimosis Garlic Capsules. And for those of you who are interested in Alpha Monday Lotto results, here are the numbers: 61, 20, 49, 67, and 79. The numbers again: 61, 61, 20, 20, 49, 49, 67, 67, and 79, 79. Alpha Monday Lotto results: 61, 20, 49, 67, 79. Somewhere around the world or around this country, somebody's jumping up and down and say, I've won, I've won, I've won. Keep winning by watching GTV Breakfast. We have our conversations on Asante culture, tradition, and history coming up in the third hour of the show. But ahead of that, we've got sports at 7:15, and Daryl Alantego is up and about inside Kumasi. He's going to give you the sights and sounds as he keeps an eye on what's going on today, Tuesday, beautiful April day like this. This is GTV Breakfast. Keep watching. My name is Kafui Dey.